DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, thanks for joining me today on DocTalk. We're going to talk about needles, injections, syringes, something that's an everyday deal that sometimes we can get a little complacent, not think about, but it's something that's so important for the health and well-being of our cattle. Thanks for watching DocTalk. I'll be right back.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodyrus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson. I'm a veterinarian with Production Animal Consultation located in Manhattan, Kansas. Been doing DocTalk a long time and glad to have you join us today. We're going to talk about needles, syringes, injection sites. It's kind of BQA 101, and if you aren't BQA certified and you own cattle or you work with cattle, you really need to do it. And the Beef Quality Assurance platform has been around since the 80s. It started out to prevent residues in carcasses from antibiotics to making sure that we're doing the ordinary things extraordinarily well on our ranches, stocker operations, and feedlots. But I want to start out first by just talking about injections in general. And whether we're using a vaccine, we're using a dewormer, we're using an antibiotic, giving injections to cattle is something that we do almost every day, but if not every day, routinely. And it's something that we take for granted of whether we have clean needles, clean syringes. And I always give the example of this, that if you don't want to spend money on needles or spend money on syringes or spend money on making sure that you have your equipment clean, just pray to God that our local MD doesn't follow suit. Because when we walk in and we go in to get our annual booster, and if you're the 10th or 12th person in line at the Walgreens or whatever, just pray that they're getting you a clean syringe and a clean needle, and you'd think that way when we're dealing with our cattle. So let's start out with the three types of injections that we really do, and really one is the one we do the most. But there's intravenous or IV, which means that we are going to inject or infuse a product into the bloodstream, and usually we pick the jugular vein to make that injection into cattle. The second type of injection is what we would call intramuscular or IM. And an IM injection is exactly what it sounds like. We are going to go through the skin, through the subcutaneous space, and into the muscle, and deposit that into the body of the muscle so that it can then be absorbed. And that's where a lot of our vaccines in humans and that are. And then the third type is subcutaneous or sub-Q, okay? Subcutaneous is depositing the vaccine or the dewormer or the antibiotic between the skin and the fascia or the lining of that muscle. And we want to put it in that subcutaneous area. And with BQA, we don't want to deposit more than 10 cc's of a product in one site. We want to make sure that the injections are 4 inches apart if we're doing multiple injections, or your fist or your hand width apart. But all of these products go through testing. So if it says on the label that this should be administered IV or IM or sub-Q, pick the one that's on the label, because the antibiotic residues that we're trying to avoid when we hold these animals on withdrawal for safe to ship are all established by FDA and the research bodies based on the type of injection site that's on the label. If you even change the type of injection from sub-Q to IM or IM to IV on a product that shouldn't be, then your withdrawal time has been changed due to the ability for the animal to absorb it from the different sites. We're going to take a break. When we come back, we'll talk about selecting needles for the different types of injections. You're watching Doc Talk, and I'm glad you joined us.
Hello there, Dr. Nick Wagner, Professional Services with Neogen, and today I wanted to talk about product labels and food safety. One of the first things that you want to make sure you do with injectable products when handling is make sure that you store them properly in order for them to be effective when you go to use them. The other thing is always check expiration dates, because you don't want to use an expired product, because that could lead to concerns with efficacy of the product, could lead to concerns with reactions in the animal, or is also concerned with the regulations from the FDA's standpoint. One of the other things then when you read that label, you want to make sure that you understand what the dose is and how you administer that product, whether it's an intramuscular injection or whether it's a sub-Q injection. Because if you're not giving the injection in the proper location or the proper tissue of the animal, it may impact the effectiveness of it, or the possibility that the body absorbs it differently and potentially could change withdrawal time. That's a concern with potential residues. And then that leads us into understanding and making sure you check the label for the withdrawal time, and then understanding what that is and making sure that it elapses before you ever consider any decisions to market that particular animal. And then one of the last things, keep records so that you know when you gave those treatments, so that again, you're able to respect that withdrawal time. But all of these things come down to making sure that we avoid any residues and we produce a safe, wholesome product for the consumer.
Thanks for watching Cattle Intel by Neogen.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to Doc Talk. I'm Dr. Dan Thomson. I'm a veterinarian in Manhattan, Kansas, and practice in Kansas, Nebraska, Iowa, multiple sites, and producers from cow-calf to stockers to feedlots. We're with a group called Production Animal Consultation, and you can check us out on the web at packdvms.com. We're talking about injection sites. So we talked about the different types of injections, sub-Q, IM, and IV. Almost all of our products today are sub-Q. Very few, besides some of our repro products, are what I would say intramuscular anymore, and very few are intravenous. Sodium iodide is still IV. But first of all, you know, some people say, well, I want to IV it instead of IM or sub-Q because it'll get into their system faster. It doesn't. Research has shown that it's like saves you maybe 20 to 40 minutes. And if we're talking about something 20 to 40 minutes on a cough or increased body temp, we probably got bigger issues than where we put the antibiotic. But the different types of needles with the different types of injections is important to understand. So an IV injection we're going to use, and you remember some of the old big 10 gauge needles that we would do to IV cows that are milk fever cows, and to have faster absorption or faster dispensing or administration of some of our bigger volume products. But Really what we're doing is a 16 to 18 gauge needle for IV injection, and we'll use a 1-inch needle for those. If we're doing intramuscular, which again, we want to go perpendicular to the hide, and we want to make sure that we deposit in the muscle, we'll use an inch to 1.5 inch needle. And most times what we're going to use is a 16 to 18 gauge needle. There's no need in going up to a 14 gauge. It causes a lot more pain. It's a bigger needle. And if you go smaller than that, it's harder to push the product through the needle. Obviously, the smaller the needle, the less the pain, but the smaller the needle, the less the volume that can be pushed through at one time. For subcutaneous injections, and we'll talk about how to administer those, the needle selection for that is a 5/8 to a 1/2 inch, 5/8, 3/4, but shorter needle, because we want to deposit that between the skin and the fascia, or the top of that muscle. We want to go into that subcutaneous, meaning under skin site. And so utilizing those, and we will use a 16 to 18 gauge. The smaller the animal, the higher the gauge. So on a 300 or 400 pound animal, we'll use an 18 gauge. On the bigger animals, we'll use the 16 gauge. There's really no need to use a larger one, and I don't even know that BQA recommends it. I didn't check this, but I'm gonna say this. If we do use a 14 gauge needle at any time, it's usually for new floor, res floor, lawn core, one of those generic new floors, that we use it when the product's a little bit colder, because it's harder to push through the needle. Again, making sure that if you do that we don't deposit more in that space than what's allowed by BQA is very, very important. But almost always 16 to 18 gauge needle, 1/2 inch to 3/4 inch for sub-Q, 1.5 inch for IM, and 1 inch for IV. We're going to take a break. We'll come back after these messages.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeda's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to BimedaBiologicals.com to learn more.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here, and we're talking about something pretty remedial to most of you, but it's a good refresher. And I had one of my favorites, because every 3 years you have to be re-upped on BQA and get recertified. And I had a producer in a meeting down south once say, why do I have to do this every 3 years? And I said, I don't know. I don't make the rules. I follow them. He said, well, I only had to graduate high school once. And I thought that was pretty intuitive. I do love our sense of humor in the barn and in the pasture and in the pickup. That said, this is going to be redundant. When we pick out an injection site, you can see from this picture, our injection site of choice for bovine is in the neck. And whether you're using a syringe or a dart gun or whatever, this triangle, the nuchal ligament, which is the ligament that runs from the pole to the withers, is the top boundary, dorsal boundary. The vertebral column, or the neck bones, is the boundary, and then the point of the shoulder is the last boundary. So this triangle, nuchal ligament to the point of the shoulder to where the vertebral column runs, in between, in that triangle, that is just skin, muscle, skin. And that's where we want to give our injections. We have the least amount of product wastage if we have an issue when we give the injection, as far as an antibiotic residue or blemish. And so what we want to do is make sure that we can prevent those. So once we pick out the right area, now we're going to determine which way that we would give. When we give an intramuscular vaccine, you're going to take the syringe and you're going to inject it perpendicular to the hide, because we want that needle to go through the skin and into the belly of the muscle, where we will deposit the product. Okay, and there's no need in tenting the skin. We just go straight in, we administer, pull straight back. When we're going to do a subcutaneous injection, you want to turn that syringe to a 45-degree angle and come in to where that we're injecting that. And before I inject, I always kind of move the syringe to make sure that it's in that subcutaneous spot. If I have caught the fascia, or if I've caught that muscle, it won't move. The end of the needle won't move. But if it's under the skin and it wiggles a little, I can then be assured that I'm in the sub-Q area. Be careful too with these chutes with these big neck extenders. They can pull the animal forward, that we don't have a very big injection site window on that calf. And most of our injection site lesions that we see at the packing plant catch that front of the shoulder, because that calf is pulled up against the head gate. But we want to come in at a 45-degree angle, inject it through the hide, move to make sure I am in between the muscle and the hide, and then inject that product. We used to say, hey, tent the skin, go in, pull the skin up with your free hand, place the needle behind that to make sure that you're in the sub-Q area, and then deposit the product. We don't do that anymore. We use a one-hand technique when we give shots, and the reason that we do that is because we don't want to inject your free hand. Those types of injuries have become common. The calf jumps, you jump, we get an injection site. So intramuscular perpendicular, sub-Q 45-degree angle, both of them one-handed technique. Oh, last thing, we never stick a needle that's been injected into an animal back into a bottle. Take the needle off, stick the plastic tip through the rubber tip in the product, draw it out, put the needle back on, and give the injection. Or use a new needle just to draw. The reason why we do this is because we don't want to contaminate the bottle, even if it's an antibiotic, such that we get injection site abscesses from a little fleck of manure or whatever winding up from off the hide back into the bottle. So don't stick a dirty needle back in the bottle. We're going to take a break. When we come right back, we'll talk about cleaning up equipment.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrosyn by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrosyn.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrosyn.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idex.com/DocTalk.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson, production animal consultation in the state of Kansas. Glad to see everybody. We're talking about injection sites. Now, let's talk about syringes and needles. First of all, we're going to change the needle after about 10 injections. So if I give 5 to one animal in a 50 ml administration, I'm only going to work on 2 animals before I change that needle. And so they get burred and they causes more pain and tearing of the hide if we don't change the needles appropriately. If I'm processing, I just do it whenever I'm going to change implant cartridges. I stop and change my needle at the same time because I've got some downtime anyway. Now, with syringes, there's multi-dose syringes with vac pack and tubing that we use with the pistol grip type. There are types of just disposable syringes that we use that are, 12 ml, 20 ml, 35 ml, and the 60 ml syringes. Now, if I use a disposable syringe, don't forget the first word I said, disposable. I'll use one for each product for that day. So if I have Nuflor, if I have Araven, if I have Batril, whatever, I will have a syringe for each one of those. And if it's a bigger dose product, I use a bigger syringe. If it's a smaller dose product, like a macrolide, like tulathromycin, Draxin, and that, I'll use a 12 cc syringe. Smaller syringe, easier to handle, easier to use. Bigger syringe, draw it out once, go give the injections. But they're disposable. I get done with the day, I throw them away. I see people trying to keep them, try to reuse them. It's better to just throw them away to prevent injection site lesions or getting an infection in that syringe. Now, on our pistol grip, bigger syringes with the tubing, to clean those, what we're going to do is take them in and we're going to first clean the exterior, clean the manure off the outside of the tubing, of the syringe, and that. Then we're going to flush that thing multiple times with water. Just use hot water. There's no need to use soap. There's no need to use disinfectants. We can just use the hot water to make sure that we clean the inside of it. Then on some of these products, you're going to want to either take the syringe and boil them. You can boil them. Or if it's a microwavable type syringe, you can take that syringe and the tubing, fill it full of water, wrap it in about 5 to 10 layers of wet cloth, paper towels, and put that in the microwave for 4 or 5 minutes. And then when it comes out, remember it's gonna be hot, okay? But we can then go ahead and empty that. And then the way I like to store them after we clean them, whether we boil them or whether we rinse them or whether we microwave them, is we like to put them in a, and I want to make sure that everybody understands, all of this is dangerous. Don't let little kids do this. If you're doing this yourself at the home, I use different multi-guides, and I got this multi-guide here from the University of Wisconsin that you can see on boiling and microwaving. So this is not a Dr. Dan plug, but make sure you're safe with it, okay? But I like to store them, then I put them in a Ziploc baggie so I don't get dust and that if I'm not going to use them right away. And you can store them in a place that's dust free. Okay, there's lots of different places within your working facility or within your shop that are dust free, that you can clean them. But very, very important and very, very practical. Thanks for watching Doc Talk today. We couldn't do it without you. Again, do ordinary things extraordinarily well to have a great, healthy, sustainable cow herd. Remember to always work with your local veterinarian, and if you want to find us on the web, you can find us at www.doctalktv.com. I'm Dr. Dan Thomson, and I'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.